$3.8 million invested and more than $3.9 billion received. In this episode of the Subsidy Files, we're going back to 2020, looking at Tennessee-based HCA Healthcare. At the end of 2020, they disclosed $59 billion in revenue, with a gross profit of $43 billion and a net income of $3.75 billion across its network of 182 hospitals, as per Becker's Hospital Review and Macro Trends. Also, HCA's federal income tax rate came in at 16.9%. HCA spent $1.4 million on various political contributions, and the remaining $2.4 million secured HCA representation by 4 lobbying firms and 23 individual lobbyists in sum $3.8 million. In all, HCA representatives lobbied 3 government agencies, 47 bills, and mostly raised issues with H.R. 5302, the Surprise Medical Bill Act. Concerning medical surprises, 66.5% of personal bankruptcies in the United States are directly related to medical expenses. Of those who did declare bankruptcy, 17% lost their home because of it. Approximately 51% of single-person households with private insurance in the United States are unable to pay a $6,000 medical bill, and 32% are unable to pay a $2,000 medical bill. Of course, this is by far worse for the un- or underinsured. HCA's lobbying efforts did not only result in continuing to disadvantage Americans, but also secured them substantial funding. $525.5 million in grants, $3.375 billion in bailout loans, and $82.5 million in federal and state as well as local subsidies. Moving on to compensation. In 2020, HCA CEO Sam Hazen received a total compensation package worth $30.4 million, with a base salary of $1.3 million. In all, Hazen's compensation ratio is in excess of 500 to 1 to the median HCA worker pay of $56,000. The sum of HCA Healthcare is essentially pretty disturbing. They invested $3.8 million in lobbying and contributions and received $3.9 billion in return, mixed between grants and various low or no interest loans as well as subsidies. All that on the heels of $3.75 billion in net profit in 2020. Meanwhile, Americans are either avoiding medical care altogether or face potential bankruptcy if they get medical care.